Mr. Speaker, with only 10 voting days left in this year's calendar, Congress must act if we are to avert a full-blown health care crisis. And I rise today to bring attention to affordability and the health care crisis that is pending upon us. I think this is what Americans want us to do, as opposed to bailing out Argentina or figuring out how to finance a $300 million ballroom that will dwarf the size of the White House. What Americans are concerned about is premiums that are climbing. What Americans are concerned about is the increase in their grocery bills. What Americans are concerned about, that I represent in the San Joaquin Valley, is bearing more and more of this burden and not seeing any potential light at the end of the tunnel. Families are forced to make impossible choices, putting food on the table or whether or not they should keep their health care coverage. In July, the President Trump's one big, I never thought it was beautiful, became law. It slashed over $1 trillion from Medicaid, from children's health care coverage, and from Medicare, and the Affordable Health Care Act, and at the same time adding $4.2 trillion to our national debt. Programs that protect children, seniors, and working families are being gutted. In my district alone, only over 65,000 risk losing their Medicaid coverage and threatening access to essential health care for vulnerable populations. And now, despite the passage of the fiscal year 2026 continuing resolution, my colleagues on the other side of the aisle once again have failed us, I think. Republicans are threatening the Affordable Health Care Act's enhanced premiums that will expire, these tax credits, by the end of this year, 4 weeks away. And open enrollment is now, and Americans are seeing the costs that they are paying for this effort that has failed so far. But there's still time. There's still time where families can avert the stark choice of having to pay more for their health care or make sacrifices elsewhere in their lives. There's still time, if we continue these tax credits, that we will avoid the dramatically higher health care that our constituents are paying in co-payments and deductibles, up to 22,000 people in my congressional district alone. To illustrate what this means, a couple who are 60 years old in Fresno earning $82,000 a year will pay $18,000 more per year for coverage. A family of 4 in Tulare County earning $64,000 a year will pay $2,500 more. This is not fiscal responsibility. This is a Republican health care tax hike on working families imposed in the richest country in the world. I think it's unacceptable. It's just not numbers on a page. It's real people. It's the mother in Fresno who has to choose